Hey there. If you've ever tried to get your head around all the different antihypertensive medications, you know it can be a real challenge. Well, you're in the right place. We're about to break down the most common blood pressure drugs using a super simple framework that's going to save you a ton of study time.
Does it ever feel like you're just buried under this mountain of drug names, mechanisms, and side effects? Yeah, you're definitely not alone. Trying to memorize every single medication for high blood pressure is, let's be honest, incredibly tough.
But what if I told you there's a simple framework, one little trick that can bring some serious order to all that chaos? That's exactly what we're going to do. We'll use this one powerful idea to organize these drugs so they're way easier to understand and, most importantly, to remember. So here's the game plan. First, I'll introduce you to our guide, the ABCD mnemonic. Then we're going to crack the code on how these drugs are named. After that, we'll dive into how they actually work in the body. And finally, we'll tie it all together with the big one, the fundamental blood pressure equation. Ready? Let's jump in. Okay, the absolute core of our system today is this super simple mnemonic, A, B, C, D. Seriously, think of this as your new mental filing cabinet for all the main classes of antihypertensives. And it is beautifully straightforward. A stands for 3 classes: ACE inhibitors, ARBs, and alpha blockers. B is easy, that's for beta blockers. C is for calcium channel blockers, and D is for diuretics. Just getting this one framework down builds such a solid foundation. All right, knowing the classes is a great start. But how do you look at a specific drug name and know where it fits? Well, the secret is hidden in plain sight. It is all in the suffix, the end of the word. And here it is. This is your cheat code. ACE inhibitors, they almost always end in pril. ARBs end in sartan. Alpha blockers end in osin, and beta blockers famously end in lol. The pattern keeps going. Calcium channel blockers with dipine, and a whole lot of diuretics end in ide. Now let's see it in action. Check this out. Lisinopril ends in pril, so it's an ACE inhibitor. Losartan, that's an ARB. Metoprolol, that lol suffix tells you right away it's a beta blocker. See? Once you spot this pattern, you really can't unsee it. Okay, so now we can identify the drugs, but what are they actually doing inside the body? Let's start with our A drugs. Their main job is to target one of the body's most important systems for regulating blood pressure, the RAAS system. The renin-angiotensin-aldosterone system, or RAAS for short, is basically a cascade of hormones. The big thing you need to know is that it produces this substance called angiotensin II, and this stuff is incredibly powerful at constricting blood vessels and making the body hold on to salt and water, both of which, you guessed it, jack up your blood pressure. So ACE inhibitors and ARBs both go after this system. They just do it at different spots. ACE inhibitors stop angiotensin II from ever being made in the first place. ARBs, on the other hand, they let it get made, but then they block it from actually doing its job. The end result? Exactly the same. Blood vessels relax, and the body gets rid of more fluid. Okay, now let's talk about the B, C, and D drugs. These guys use totally different strategies to get to the same finish line, lowering that blood pressure. These drugs mess with the sympathetic nervous system, our fight-or-flight response. When this system gets activated, it pumps out hormones that hit alpha and beta receptors, which revs up the heart and squeezes blood vessels, shooting blood pressure way up. So alpha blockers, our third A drug, they focus right on the blood vessels. They get in there and block those alpha-1 receptors, so the vessels never get the signal to constrict. This lets them relax and widen, which brings the pressure down. Beta blockers are B drugs. They do their work on the heart. They block beta-1 receptors, which basically tells the heart to just chill out. It starts to beat a little slower and with less force, and, a less forceful pump means less pressure in the whole system. Simple as that. Next up, C for calcium channel blockers. So here's the deal. Any muscle contraction needs calcium. These drugs work by blocking calcium from getting into muscle cells. The dipine types we talked about, they mostly target the muscles in your blood vessels, causing them to relax. There are other types called non-dihydropyridines that work more on the heart, kind of like beta blockers do. And finally, we get to D for diuretics. This mechanism is probably the easiest one to grasp. Diuretics, well, they make you pee out more salt and water. It's pretty logical, right? If you have less fluid volume inside your pipes, the pressure in those pipes is naturally going to go down. So we've got all these different mechanisms. How do they all connect? Well, it turns out they all manipulate one of just 2 factors in the fundamental equation of blood pressure. And here it is. This is what it all boils down to. Blood pressure is simply cardiac output, which is how much blood the heart pumps out, multiplied by systemic vascular resistance, which is just how squeezed or relaxed your blood vessels are. Every single drug we have talked about works by lowering one or both of these two things. And now we can map everything back to this equation. Look, beta blockers and diuretics, they primarily decrease cardiac output. Alpha blockers and those dipine calcium channel blockers, they primarily decrease the vascular resistance. And the RAAS drugs, our ACE inhibitors and ARBs, they actually do a bit of both, which makes them really versatile players in the game. So there you have it. We went from a totally confusing list of names to a clear, organized system. The ABC mnemonic, the suffix trick, and this final equation give you an incredibly powerful framework. But this isn't just about memorizing facts. It's about appreciating all the different, really elegant ways we can interact with the body's complex systems. So I'll leave you with this. Which one of these mechanisms do you find the most fascinating?